Good evening, everybody. Welcome to the D.P.T. White Coat Ceremony for the class of 2027. To start us this evening, I'm going to invite Rabbi Fogel to start the invocation.
Ribon Kol Ha'olamim, Master of the world. Bless all who have assembled here today. Take part in the White Coat Ceremony for the D.P.T. program of the School of Health Science and Practice of the New York Medical College class of 2027. Almighty God, Rofei Chol Basar U'Mafli La'asos, healer of flesh and wonders in all of your acts, you have instructed and empowered humanity to provide relief, comfort, and aid to all of your children. We and all who are involved in the citadel of medical education are your agents in this task. May your abundant blessing always be showered on those who enter the halls of this institution. Give strength, courage, and fortitude to the women and men who now prepare to engage in direct patient care. Bless them as they set out as your agents to serve those in need, those in pain and discomfort, and all those who seek their healing. Grant them the wisdom and the strength to strengthen the weak and uplift those in despair. As our students begin the actualization of the knowledge that they have acquired, we pray that you imbue these men and women with the highest standard of ethics that are at their core of their training. And we pray that they remember the principles to which they were educated. Grant them the ability and insight to see the great potential that lies within each person that seeks their care. The white coat not only signifies a transition to direct patient care, it also signals to yourself and to the world that you are on the front line, that you have dedicated yourself and your careers to help others, to heal and to nurture. And we pray that you receive this, as you receive this symbol, the meaning of the white coat will inform and enlighten your decision from this moment onward. At this auspicious occasion, we pray to you, dear God, that you shower your blessing on our students and all their dear ones, parents, children, mentors, spouses, and other loved ones who have been there for support and encouragement, who have helped them and sacrificed so much so that our students can persevere and succeed. And we humbly ask that you bless the administration, the staff, and the faculty of the New York Medical College School of Health Science and Practice, dedicated women and men who strive to impart knowledge, achieve excellence, and lead by example. Grant them the wisdom, the resolve, and the fortitude to continue their noble mission of educating the next generation of healers and caregivers who will be exemplary in their caregiving. Tura University as a core mission was created to serve, strengthen, and improve your world, dear God. And we ask for your continued divine guidance so that we together can achieve that great potential. Amen. You may now be seated.
Thank you, Rabbi Fogel. Good evening, everyone. I'm Dr. Janet Dolad. I'm the interim program director of the program in physical therapy, and I get the wonderful honor of kind of hosting this event and kind of leading us through this event. I want to welcome you again to being here. Welcome to the members of the class of 2027, and a very warm New York Medical College welcome to all of your loved ones who are attending tonight. The faculty and the staff of the Division of Physical Therapy and the Department of Rehabilitation Sciences are very pleased that all of you could be here. So many of you may know that the White Coat Ceremony is an auspicious event and a rite of passage for students entering doctoring professions. The white coat symbolizes clinical knowledge, professionalism, and responsibility. Donning the white coat serves to remind wearers of their professional duty to practice with honor, caring, and a patient-centered approach. So as most of you know, the class of 2027 have been working very diligently since the summer semester to develop their knowledge base, refine their hands-on skills, and cultivate habits and skills of the head, hands, and heart. All this in preparation for their upcoming clinical education rotations. So this ceremony signifies their transition from purely campus-based coursework to participating in their clinical education experiences where they will work with real patients. So this evening, as we mark this occasion, our school's leaders, faculty, and a D.P.T alumnus will offer words of wisdom to the students. This will be followed by donning of their white coats and recitation of the PT pledge. So Dr. Edward Halprin, MD, serves as the Chancellor and Chief Executive Officer of New York Medical College. He typically leads us off with words of wisdom on this evening. Unfortunately, he is not able to attend this evening. He offers his congratulations and his sincere regret. Dr. Robert Amler, MD, is the Dean of the School in Health Sciences and Practice. Unfortunately, he is not here this evening. However, we do have a recording of his words for you, so we'll play that now.
Hello, I'm Dr. Rob Amler, and it's a privilege to be your dean. I'm very sorry that I can't be with you in person for this special event. I'm in Washington, D.C., dealing with some major budget issues that affect our school, our campus, and many other schools as well. But today is your day, April 10th, the day, first day for most of you, that you're putting on your white coat for the very first time. And let me tell you, it feels great when you put it on. You're in for a real treat. What is the white coat all about? Well, it shows that you're clean. It shows that your clothing is protected. It shows a lot of things, but it also symbolizes a lot. It symbolizes trust. It symbolizes stability. It symbolizes competence as someone who's not only there to help people, but has an important skill set that can really make a difference. And that makes all the difference, because when you finish this program, you will not only have the motivation to cure problems, to treat problems and ease suffering, but you're going to have the complex set of abilities to make it happen and make real change happen for your clients, your patients, as well as their families. Because who doesn't think about the effect of a family when someone is injured or impaired? When you can help fix that, you help a lot of people. And I predict, and you can hold me to this, in the course of your careers, you are going to help thousands and thousands of people who are out there and don't even know today that they're going to need your help down the road. In fact, I will say that you're going to help some people who haven't even been born yet. Think about that. Think about what that means. Also, as our Chancellor, Dr. Ed Halprin, has often said, it is the beginning of the end of narcissism. What? Narcissism? Me? How can you say narcissism? I'm not narcissistic. Well, think about it. It's such a great personal pride to be a doctor of physical therapy, and you will be standing up in front of your family and friends and loved ones, holding yourself out as this newly appointed, newly anointed professional. And yet, from the minute you put on that coat, it's not about you. It's not about your drive to work that morning. It's not about your lunch break or getting home on time or getting home late. It's about the patient and what their needs are, what's important to them, and how you can make a difference in their lives. So I say to you, with that coat on, think always of the patient and what they need, because remember, no one really cares how much we know until first they know how much we care. Thank you, and congratulations on the white coats.
So we'll thank Dr. Amler virtually for his kind words. Now I would like to invite up Vice Dean Ben Johnson to say a few words as well.
Well, I showed up. You're stuck with me. Well, I thank God that I didn't have to speak after the chancellor as well, because you'd find the chancellor to be as articulate, if not much more articulate, even than Dean Ambler. So it's always challenging for me to be third in the lineup behind those two. So at least I only had to follow Dean Ambler tonight. But seriously, thank you all for coming tonight. It's nice to see all the family, friends, significant others of our student group here. I had the opportunity yesterday to spend about 45 minutes in conversation with this group. And let me tell you, they were outspoken and very forthcoming with information. And I am not accustomed to students doing that. Having been in the classroom for over 40 years, it's hard to even get a word out of a student's mouth sometimes in class. So it really was very much appreciated, the feedback that you provided yesterday. You're almost to the end of that first year, and you're doing great. And tonight is a symbol of that hard work and what your future is going to hold for you. So we thank you for choosing New York Medical College, and we thank all of you in the audience for attending tonight and allowing us to shepherd your kid, your friend, your child, what have you, through our program. So thanks so much.
Thank you, Dr. Johnson. Now I would like to invite Dr. Vikas Grover, PhD, Chair of the Department of Rehabilitation Sciences, to share a few words.
So hello, everyone. Welcome. I'm so glad that you all were able to make it here tonight to celebrate this special day for our students. While I was preparing for this white coat ceremony for the PT students, Dr. Dulat said it's from 5:30 to 7 p.m. And you can see I put some question marks there. 5:30 to 7 p.m. Is that what it is? So we'll talk about this. Neil Walsh had said that life begins at the end of your comfort zone. Can you hear me now? Okay. I got a signal from there. Louder. So anyway, life begins at the end of your comfort zone. So for the benefit of today, let's adapt it to white coat begins at the end of your comfort zone, right? So did the white coat ceremony really begin today at 5:30 p.m.? If you ask me, no. I think it began much earlier than today. You stepped out of your comfort zone when you decided to choose this profession as your career, right? You knew that you'll be working with individuals who might have some pain going on, some suffering going on, some mobility issues going on, but you decided to do that. You stepped out of your comfort zone. When you came to the first class feeling a little uncomfortable, yet excited for your new journey, not very comfortable, but still excited. And that's when you stepped out of your comfort zone. When you realized you might need to redesign your patterns of learning from your undergrad to your graduate education now. Why? Because now it's the application of what you have already been learning, right? You stepped out of your comfort zone when you sat in the class and thought, this is difficult. I don't know if I'll make it. Is it for me? Am I for this? Anatomy, physiology, exercise physiology, cardiopulmonary, I don't know. So, stepped out of your comfort zone. I wrote here, started working, but I realized when Dr. Dulat said, you're transitioning into that clinical phase now. So when you started thinking about what you'll be doing in your clinical work, when you started thinking about how you will apply the concepts that you have started learning in your first year, right? When you studied for hours and hours on weekends, sacrificing your weekend fun, you stepped out of that comfort zone. It was tempting, weekends, but you didn't. You spent time studying. So Socrates had once said, we were taught to memorize answers, but not to question questions, right? The real journey of white coat started when you began questioning questions and using critical thinking. Why do I say that? Questioning question, and what does it mean? If you think about questions, when you learn concepts in your undergrad, You think about questions, what questions, where questions, who questions, why questions, simple questions to learn the concept. But here we are dealing with humans. Here we are dealing with the applications of those questions. And you start to realize, oh, there is more depth than the surface level questions. We are going to think about it deeper. We are going to think about it to actually apply the concepts in a way that can help someone else. So you start questioning, am I asking the right question? And that's what I mean by questioning questions. So what does the white coat generally symbolize? Dr. Dulot talked about it, Dean Ambler talked about it, professionalism, responsibility, and commitment. But I want to bring your attention to some building blocks to those things, right? Compassion is the first word that comes to my mind. What does it mean? The root of the word compassion is to suffer with, or fellow feeling. Now, suffer with, I don't mean that you will have experienced the same pain somebody is experiencing. What does it mean? It means to understand the person and the feeling behind that pain. What does it do to his life? How is his daily life affected, or her daily life affected with that? Understanding that requires you to come out of yourself first. Out of yourself means out of the PT role and understand the human part, right? So compassion, humanness, state of being a human. We all are humans. Why do I emphasize the state of being human? Because in our fast-paced life, in the life with AI, automation is so high. You can get nearly every answer you type. Can you find this? And boom, the answer is there. But the humanness is going to still stay the same because you're dealing with somebody who might be able to express the need better than what AI could answer. Service. We are going to be providing service, people. Act of serving or helping. We can serve with our toolkits. We can serve with our expertise that has been developed in the first year or second year, third year. But to go back to the human and say, is this helping you? Am I understanding it correctly? Will actually create that real meaning of service for that individual, which might differ for another individual. So those are the words that I feel are building blocks for those professionalism, responsibility, and commitment. So any classroom learning, any speech comes with an exercise, and here is an exercise for you guys. I would need some volunteers. Raise your hands who want to answer. Here are some words, right? Your job is to tell me, how should we sequence them? What should come first? What should come second? What should come third? Any volunteers are welcome. Go ahead. Sorry? Diagnose. Good answer. But all these are going to be used. Go ahead. Sorry. They're all equally important, right? You see that? We cannot think. Great. So you see? Anyway, so white coat ceremony. Not 5:30 to 7. I disagree, right? It started a long time ago, and it's going to be a lifelong process, right? This is just the time to remind ourselves of the path we are already on. So having said this, congratulations and time to celebrate. Thank you.
Thank you, Dr. Grover. I would like to now introduce Dr. Christina Welsom, PT, D.P.T, Assistant Professor of Physical Therapy, to deliver the faculty address.
Thank you. I'm going to start by saying bonus gold star for communication, professionalism, providing feedback, and conflict resolution. I heard great feedback today about that from you guys. So welcome to the white coat ceremony, everyone. And as a physical therapist, what is kind of interesting about this white coat ceremony is that it's sometimes the only time you will see us in a white coat. In many of the clinical settings that physical therapists work in, we don't always have our white coats. When we work in a hospital, it's a great place to hold our oxygen tubes and our notes and our stethoscopes and things like that. But most often you will see us rolling up our sleeves, taking off our coat, kicking off our shoes, crawling onto the bed, dropping down to the floor, and meeting our patients where they're currently at in whatever their current situation is, because it's important for us to be completely present in that lived experience that they're going through. So I want to remind all of you in the audience, I know the class knows the 7 core values of the American Physical Therapy Association of accountability, altruism, caring compassion, excellence, integrity, social responsibility, and professional duty. And that lives within each and every one of you, whether the code is on or off, because it lives in your individual heart, in the human that you are. So it's not this coat that makes you an empathetic and effective health professional. It's the human that's wearing the coat that makes the biggest difference in the lives of your patients. The importance of the therapeutic alliance you will create with them is the critical link between the knowledge and skills that you possess and the wants, needs, desires, and goals of each of your patients. So as you collaborate to address their unique and specific biopsychosocial challenges to improve what can be improved and to prevent what can be prevented. You will not be treating a medical diagnosis, but instead you will meet each and every patient in the moment of their life that with the cognitive, emotional, psychologic, or physical intervention strategy that is needed at that time for that person to move them forward on their individual journey. So oftentimes patients see the white coat of a doctor and they recognize an authority figure who arrives to magically fix them or to tell them what to do. I would instead like to take this time today to encourage you to recognize that in our collaborative care model, instead, our job is to take the patient by the hand, walk side by side with them as you share the knowledge, the skills, your experience, and the heart that lies under your white coat, as you strive to transform and optimize each individual human life that you will have the privilege to touch during your career. I wish you the best of luck on your first clinical experience and on the rest of your clinical professional journey. And I remind you that the greatest gift you can bring to another human being is the love and the caring that you already have within your own heart.
Thank you, Dr. Elsa. Lovely. So each year, we invite a distinguished alumnus to share their thoughts about developing as a professional. I need to get my glasses on because I have a lot of good things to read about our alumni speaker this year. This year it is Dr. Emma Shunk. Dr. Shunk is a member of the D.P.T class of 2019 and is a licensed physical therapist with a focus in pediatric therapy. She began her career at Elizabeth Seton Children's Rehabilitation Center and Putnam Hospital Center. During this time, she acquired valuable experience with complex pediatric cases and developed a greater appreciation for inpatient care. She is currently working for Danbury Hospital, part of Nevins Health, at Main Street Physical Rehabilitation within their outpatient pediatric department, where she serves as a clinical instructor for D.P.T students. So Dr. Shunk works with children of all ages and a wide range of conditions such as prematurity, torticollis, developmental delay, cerebral palsy, and autism spectrum disorder. So I would like to introduce to all of you Dr. Emma Shunk.
Good evening. I wanted to thank Dr. Janet DeLotte and New York Medical College for welcoming me back as alumni speaker. I am honored to be here today. The white coat ceremony symbolizes a unique step on your way of becoming a physical therapist. As you start this transition from academic to clinical, I encourage you to always remind yourself of your goal. You are pursuing this field because you want to help people and make a difference. It is now time to put the late night studying and practicing on your classmates into action. Clinical rotations provide you with a unique opportunity to utilize the skills you've learned, apply clinical reasoning, and create memorable human interactions. These affiliations will be your greatest learning experiences. Remember, it is a privilege to be at these settings, and it's your responsibility to take advantage of every opportunity. Your clinical experiences will be challenging, and they should be. Take initiative, seek feedback, and don't be afraid to make mistakes and ask questions. As I was preparing this speech and reflecting on my own clinical experiences, I created 5 pillars I wanted to highlight today: professionalism, communication, clinical skills, exploration, and building your network. It goes without saying you should always maintain a professional demeanor. But what does that mean exactly? Each day on your rotation, it is expected to put your best foot forward. You are accountable for the decisions you make and the effort you put in daily. Be confident, but leave your ego at the door. Stay flexible and keep an open mind when receiving feedback or constructive criticism. I remember towards the end of my first rotation in outpatient ortho, a patient was trying to schedule appointments at the front desk. He kept requesting all sessions with Emma, which the receptionist was very confused by because I wasn't a listed therapist. The patient reiterated he wanted to work with Emma and not my CI. He really didn't want to switch therapist, but also didn't realize I didn't have a schedule of my own. It was that moment for me, I realized I wasn't viewed as a student, but rather my own professional. Put the time and effort into creating these moments for yourself. They will be those special reminders that you can do this. The white coat may be a materialistic symbol of becoming a doctor. However, the actions you take and the way you carry yourself is what's shaping you into a professional. Communication. Clinical rotations will be providing you with more chances than you can imagine to become a better communicator. Whether it be with your CIs, patients, families, other disciplines, or coworkers, communication is a large part of our daily responsibility. Your clinical instructors will be your biggest resource. Use them, ask for their help, pick their brain. They have been in your shoes. I was in your shoes 6 years ago, and now I'm standing here before you guys. Building rapport with your patients is essential too. When you are sick, in pain, and recovering, you need love and support. Your compassion to your patients will go a very long way, especially if you want them to be compliant with their HEP. During my inpatient care rotation, I grew very close with one particular family and the patient directly. She had been in and out of the hospital several times, and each time I was assigned to her. She was supported by many, many family members, but I remember specifically 2 brothers were always there. Unfortunately, her function was declining and outcomes were not favorable. I took extra time during the day to sit down with the oldest son and have that important and uncomfortable conversation. I was a listening ear and a calming present during such a devastating time. The interactions you encounter are real. Your patients are somebody's parents, grandparents, child, sibling. Have those hard conversations. Relate to them on a deeper human level. And be a part of their support system, as if it's one of your family members. Clinical skills. Physical therapy services provide very hands-on techniques that require practice for proficiency. Myself being in the pediatric field, I know more than ever there's a big difference between practicing on your classmates versus a live patient. As you enter the clinical field, a large goal of yours should be to improve your assessment strategies and the treatment methods that you've learned in your coursework thus far. There is not a single human body that is composed of or moves the same as another. Each and every patient that falls under your care is a unique, specialized opportunity to refine your clinical skills. Not only do you want to gain as much time as you can to practice, but you want to make sure you're being effective. Ask to perform on your CI for feedback or request hand over hand when executing something new. Experiment on those special patients who you have an extra connection with, and are willing to give you more time for your own learning. Maintaining your composure and remaining calm is crucial in our field because of the therapeutic touch we provide daily. If you're fortunate enough to get a clinical rotation with myself, be ready to hold a crying baby on day one. It's not to torture you, but instead to help you feel comfortable being uncomfortable. There are techniques I feel I could do in my sleep. This is because of the time and effort I've put into my practice, but also learning to master it on those hard, challenging, non-compliant patients. Time in the classroom is spent to gain knowledge, but time on your clinicals is designed to apply your practical abilities. Exploration. The clinical program is structured to provide you with a variety of work settings. This gives you a glimpse into the possibilities of what you can do in your physical therapy career. Go into each rotation with an open mind. I promise you can find value in each setting, even if it's not your highest area of interest. These experiences are really what you make of them. Before even starting physical therapy school, I knew I wanted to work in pediatrics. I had only a few observations at a hospital and never thought I'd really be interested in this area. My second rotation at Putnam Hospital Center, I came to find myself pleasantly surprised and find a passion for acute care. I took it upon myself to explore this area more by asking an orthopedic surgeon to observe hip and knee replacements. Fortunately, I got to spend 8 hours in the OR, one of the coolest things I got to do, which allowed me to better appreciate where these patients are coming from and what they go through. With that being said, I knew my heart was still with children. I was lucky enough to have 2 clinical settings in pediatrics, one in a school and the other an outpatient. And being exposed to this variety really allowed me to make the decision of ultimately becoming an outpatient pediatric therapist. The beauty of these rotations is they're really a short period of time. I hope you find those moments you're able to confirm your area of interest like I did. However, if you don't, that's really okay too. You can still appreciate those times you are not in your most favorable setting. Now is the time, explore all your options, figure out what you're interested in, and find your own passion. Build your network. This marks the transition from classroom to clinical, but soon you'll be taking the next jump from clinical to career. Your instructors and the connections you make on these affiliations can be the foundation of your networks. You've all heard the saying, don't burn your bridges. Remember this. You'll need letters of recommendation for going on job hunting, and your CIs are always going to be at the top of your reference list. So make sure you leave a lasting impression. You might think you're only going into an 8 or 10-week clinical, but don't forget this could also be the location of your first job. I valued my time so much at Putnam Hospital, I took a per diem role studying for the boards on a temp license to help my skills even more. This transition was easier for me than I had anticipated because I had gained so much knowledge and comfortability being there as a student. When I finished my 4th clinical rotation in outpatient pediatrics, unfortunately, there wasn't a position open at the clinic. However, my CI advocated so much for me, connected me with another clinic, Elizabeth Seton. This led to my first full-time job as a pediatric physical therapist. After 3 years at Elizabeth Seton, my CI at my last clinical reached out to let me know there was an out position open and gauged my interest. I'm happy to say my journey has come full circle, and I'm now coming up on my 3rd year at Danbury Hospital's outpatient peds clinic, which was in fact my last clinical rotation as a student. So make and maintain those connections. You are in control of building your network. You have all worked so hard to get to where you are today. Each of you are deserving of the coat you will don. It's now time to hit the ground running into the clinical field. Make every moment count. Congratulations, wishing you all the best of luck.
Thank you, Dr. Shunk. So you can see our program is blessed with wonderful alumni and just as wonderful students. And faculty and leadership and everyone else. So now is the time in our program where we're going to be helping the students to don their white coats. The faculty are going to help the students do this. So I would first like to introduce you to each of the faculty members. I'm sure you've heard a lot about us, and now you will get to put the faces to the names. So we're going to go in alphabetical order, and we're going to start with Dr. Catherine Curtis. Dr. Parmveer Koshal. Dr. Ainsley Rossi. Dr. Victor Santamaria. Dr. Nicholas Sheehan. And you've already met Dr. Tina Welsum. Okay, so students, you know the drill, I think. You're going to be called up alphabetically in groups of 7 by Mr. Nicholas Stacy Luke.
Thank you, Dr. DeLotte. Hello and good evening. First, we'd like to ask if you could hold your applause until all 7 students are called in the group, and then you can go. If row 2 could please stand and make their way to the left side of the stage. Rawan Al-Rabadi, Suwar Al-Rabadi, Alexander Anaya, Malvika Aurora, Karina Ashman, Uriel Barrera, Devori Berger. Jacob Berry, Nicholas Burt, Ariana Butler Ojoy, Daniel Carmichael, Mateo Chermelli, Jacqueline Chachuka, Santiago Correa. And if row 3 could please stand and make their way to the left side of the stage. Giovanna Cuglieri, David Devasagayam, Isabella DePippo, Quincy Downs, Olivia Everett, Samantha Fia, Charlie Garcia. Amanda Guzman, Alexandra Hoy, Alexa Iozo, Caitlin Irwin, Janelle Lawrence, Brenda Mansueta, Danielle McClatt. And now if row 4 would please stand and make their way to the left side of the stage. Adrian Mielis, Stephen Melillo, Daniel Milord, Selena Morales, Oleg Nagirny, Matthew Nieves, Akujaniram Oniobia. Duwani Patel, Richard Petrillo, Stephen Phillips, Anthony Presimone, Dimitri Prey, Michael Polney, Jonathan Rogers. Henel Shaw, Eric Tenenbaum, Rachel Wetstein.
Okay, so now I would like to invite Dr. Santa Maria to the stage, and he will lead the students in the recitation of the PT oath.
So it's an honor to share this special moment with all of you and your relatives, okay? In 2004, the House of Delegates of the American Physical Therapy Association resolved to support the use of a professional oath or pledge for students in accredited physical therapist education programs and for licensed physical therapists. This pledge serves to enhance the commitment of the physical therapist professional to the patient, client, and themselves. To the APTA Professional Vision 2020, to the Code of Ethics, Guide for Professional Conduct, and Standards of Practice, which have set forth principles and guidelines for professional behaviors, as well as the core values of the physical therapy profession of accountability, altruism, compassion and caring, excellence, integrity, professional duty, and social responsibility. At this time, I kindly ask all of our physical therapy students to stand to recite this pledge, if it's possible, please. I also invite all physical therapists in attendance to stand and join them as you reaffirm your commitment to the profession. Now, please, you will repeat after me. As I enter the profession of physical therapy to practice as a physical therapist, I solemnly and willingly pledge the following. I will respect the rights and dignity of all individuals and will provide compassionate care. I will be trustworthy towards my patients and clients and in all other aspects of physical therapy practice. I will place the welfare of my patients and clients above my own self-interest. I will provide accurate and relevant information to patients and clients about their care and to the public about physical therapy services. I will exercise sound judgment and comply with laws and regulations that govern physical therapy and protect the public from unethical, incompetent, and illegal acts. I will maintain professional competence and promote high standards for physical therapy practice, education, and research. I will address the health needs of society and strive to effect changes that benefit patients, clients, and the community. I will respect the rights, knowledge, and skills of colleagues and other healthcare professionals and seek consultation whenever the welfare of the patient or client may be advanced. Thus, with this pledge, I freely accept the responsibilities that accompany the practice of physical therapy. We feel proud of you. Congratulations. Thank you.
Thank you very much, Dr. Santa Maria. Okay, so class of 2027. This evening, you have heard speakers share important ideas about professionalism. Earlier, I had stated that the white coat symbolizes clinical knowledge, professionalism, and responsibility. I can say with confidence that you have earned these coats and hope that you will wear them with pride and with excitement. Pride in what you have accomplished already, and excitement about the opportunities you will have to impact your future patients in a positive way. All of us here look forward to seeing how you will continue to distinguish yourselves as you participate in your clinical education experiences and beyond. So to our guests, thank you for joining us for this important occasion. The members of the class of 2027 appreciate your support, right? They go to school, but you help them. They could not do this without you. So this is your white coat also. So as we conclude the evening, let's give a round of applause for all of the members of the class of 2027. Yay. Right, and those weekends spent studying, you're not really giving anything up, right? You're having fun, aren't you? Let's give some applause for all of the family and friends and loved ones who are here, and for those who wish they were here but couldn't make it today. Let's give applause for Rabbi Fogel, Dean Johnson, Dr. Grover, Dean Amler, and Dr. Shunk's presence today at this ceremony. Applause for the faculty, Ms. Francesca Menta, whom everyone met on the way in, and Mr. Nick Stacy Luke, who pronounced those names so well, I learned something. Thank you for all your support of the class of 2027. They really, I know, appreciate it. And then I would also like to give applause for our educational media team, the behind the scenes people who make this all work. Michael Potter, Juan Castro, Michael Frankfurter, Corinne Zostenchik, and Jared Shearing. Okay, so our formal ceremony is over. Thank you, everyone, for being here. We would love some pictures, though. So if the class of 2027 and the faculty and Dr. Grover and Dr. Johnson and Dr. Shunk can come to the front, we'll take a picture. And then for all the guests, we'll meet you in the lobby for more pictures and mingling. Thank you.